Hello, my name is Orit Schwartz. I am an instructor in the Rehabilitation Sciences program, and I would like to tell you about a course that I teach, AHS 330, Physical and Mental Health in Rehabilitation. In this course, you will receive a wide overview of rehabilitation. We will talk about topics such as what is rehabilitation, what are the goals of rehabilitation, and who gets to set these goals. What are some of the common approaches to rehabilitation and why are they used? There are 5 units in the course. Each addresses rehabilitation services from a very specific perspective. The first unit is about working with children. Some interesting questions to consider are, how is rehabilitation with children different from working with adults? And also, what is the role of family members, caregivers, even teachers in pediatric rehabilitation? The second unit is about rehabilitation with people who have a chronic illness. So we will talk about the impact of chronic illness on a person's life. An especially important topic in this unit is how can rehabilitation professionals support the goals and interests of their clients. Next, the course looks at rehabilitation in mental health services. The focus of this unit is on community-based rehabilitation for people with chronic mental illness. We will discuss the concepts and ideas that guide mental health rehabilitation practices in the community. The fourth unit focuses on rehabilitation following a sudden onset of disability. For example, when a person has a traumatic brain injury or a stroke. There is a lot to discuss in this unit. One of the interesting topics is research about response to sudden onset of disability and how can rehabilitation professionals use such research in their work. The final unit is about rehabilitation after surgery. Important themes in this unit include pain in rehabilitation and also return to work following the surgery. We will talk about the role of rehabilitation in helping people develop healthy habits and safe environments so they can avoid surgeries in the future. A fun feature of the course are guest speakers. Every semester, I invite professionals from various rehabilitation fields to talk with the students about their areas of expertise. Visitors we had in the past included speech pathologists, music therapist, child life specialist, vision therapist, and many others. Sometimes students discover a quote-unquote new profession, which ends up being what they decide to do in their future. You may be curious about the amount of work required to succeed in this course. Physical and mental health and rehabilitation requires steady work throughout the semester, and it will challenge you to think critically. But it is also a very accessible course that engages different learning styles to make sure that each student has an opportunity to shine. So maybe you have already decided what career you want to pursue: occupational therapy, physical therapy, maybe speech and language pathology, or maybe you're interested in healthcare and want to explore professional opportunities and career paths. Either way, AHS 330 will give you a wide introduction to rehabilitation professions and practices in various settings and situations. Physical and mental health in rehabilitation is a required course for rehabilitation sciences majors. Students from other majors or other colleges are invited to contact me to receive permission to enroll in the course. You do not need prior knowledge, only curiosity and enthusiasm. If you have additional questions or would like to talk to me more about this course, do not hesitate to contact me. Thank you, and I'm looking forward to seeing you at AHS 330, Physical and Mental Health in Rehabilitation.